Moving on, the healthcare system is one of the most important sectors in the world. Meanwhile, the country's healthcare system is poor and has had a number of setbacks. Nigeria will need to address the issue of inadequate healthcare facilities or run the risk of the health system completely collapsing and creating new problems for the country. Oluwaseyi Akinboyede has more on this.
One of the nation's most crucial sectors is the health sector. This is due to the value placed on one's health. The healthcare system in Nigeria is underdeveloped and has faced numerous challenges, particularly at the local government levels. There are no effective and adequate surveillance system created, and as a result, there is no tracking system to track the spread of infectious diseases, bioterrorism, and chemical poisoning. Inadequate human resources, poor resources allocation to health, poor infrastructure maintenance of the healthcare system, insufficient or unsafe clinical facilities or practices, or providers who lack adequate training and expertise are some factors that contribute to the poor health facilities in the country.
We are facing a lot of challenges. Now, presently, we are not growing. Instead of us to be growing, we are facing we are growing backward. Most of our medical facilitators, doctors, professionals in the field, all of them are almost out of the country. And besides, the government is not even assisting.
The health system in Nigeria is below average. And this is seen in our government officials and politicians that they even lack trust in our health system. That is why they move abroad whenever they need health care.
The Nigeria health system, one word, bad. The Japa syndrome of recent is in where our medical doctors have to run away from Nigeria to get greener pastures. This is because the welfare for our medical doctors, health workers, very, very low. Most of those things are not in order.
Inadequate healthcare facilities have a number of negative effects: unnecessary deaths, rising medical costs, quack medicine, delayed diagnosis, drug abuse, and many other issues.
It's affecting all aspects, the cardiological aspect, X-ray aspect.
The impact of serial populace is negative, is adverse. This tends to bring about drug abuse and misuse in people.
Causes the rapid death, increase in death of the masses. Lack of funding. Most of our health facilities today, the first thing they lack is funding.
Lack of access to healthcare, weak healthcare systems, high disease burden, healthcare system corruption, poor leadership and administration, lack of evidence based on interventions, poor resource management, inadequate training and education of healthcare professionals are some of the major challenges.
Low manpower presently. And when there is low manpower compared to the growth in population of the country, then there will be a kind of catastrophe.
Number one thing is low motivation. Our morale is down. When things that are supposed to be in place are not there. People lack trust in professionals, in health professionals, because when they get to the hospital, they are not seeing what they are supposed to see. They tend not to have trust in us, and also this has brought a lot of insult and embarrassment.
We need to sensitize the people in the environment, because majorly what causes this illness and death is our own ignorance.
Number one, adequate funding. Number two, adequate training and retraining of our medical workers, health professionals. Number three, our medical facilities should be well equipped. Number four, they should make sure that so many of our dilapidated health facilities should be reconstructed and renovated. And number five, we should continue to follow the due process of medical facilities.
Improving the doctor-patient relationship, better medical education, widespread public awareness, incorporating technology into healthcare, and setting up research and development centers are just a few of the issues that the nation's healthcare systems needs to address. Nigeria will need to address the issue of insufficient healthcare facilities in the coming years or risk the health system collapsing completely and causing further issues for the nation. Oluwaseyi Akinboyede, reporting for KAFTAN TV News.